In this lecture, we will review the diagnostic criteria for attention deficit hyperactivity disorder, also known as ADHD, and its various types from childhood onset to adult onset. First, according to the DSM-5-TR, that is our latest edition, ADHD is a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development as characterized by one and or two. First, inattention. 6 or more of the following symptoms have persisted for at least 6 months to a degree that is inconsistent with developmental level and that negatively impacts directly on social and academic occupational activities. Note, the symptoms are not solely a manifestation or oppositional behavior. Defiance, hostility, or failure to understand tasks or instructions. For older adolescents and adults age 17 to 18 and older, at least 5 symptoms are required. A. Often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or during other activities. For example, overlooks or misses details. Work is inadequate or inaccurate. B. Often has difficulty sustaining attention in tasks or play activities. For example, has difficulty remaining focused during lectures, conversations, or lengthy reading. C. Often does not seem to listen when spoken to directly. For example, mind seems elsewhere, even in the absence of an obvious distraction. D. Often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. For example, starts tasks but quickly loses focus and is easily sidetracked. E. Often has difficulty organizing tasks and activities. For example, difficulty managing sequential tasks, difficulty keeping materials and belongings in order, messy, disorganized work, has poor time management, and fails to meet deadlines. F. Often avoids, dislikes, or is reluctant to engage in tasks that require sustained mental effort. For example, schoolwork or homework. For older adolescents and adults, preparing reports, completing forms, reviewing lengthy papers. G. Often loses things necessary for tasks or activities. For example, school materials, pencils, books, tools, wallets, keys, paperwork, eyeglasses, and cell phones. H. Is often easily distracted by extraneous stimuli. For older adolescents and adults, may include unrelated thoughts. I. Is often forgetful in daily activities. For example, doing chores, running errands for older adolescents and adults, returning calls, paying bills, keeping appointments. Now, the second type of ADHD is hyperactivity and impulsivity. 6 or more of the following symptoms have persisted for at least 6 months to a degree that is inconsistent with developmental level and that negatively impacts directly on social and academic or occupational activities. Note, the symptoms are not solely a manifestation of oppositional behavior, defiance, hostility, or a failure to understand tasks or instructions. For older adolescents and adults, age 17 and older, at least 5 symptoms are required. A. Often fidgets with or taps hands or feet or squirms in seat. B. Often leaves seat in situations when remaining seated is expected. For example, leaves his or her place in the classroom, in the office, or other workplace, or in other situations that require remaining in place. C. Often runs around or climbs in situations where it is inappropriate. Note, in adolescents or adults, may be limited to feeling restless. D. Often unable to play or engage in leisure activities quietly. E. Is often on the go, acting as if driven by a motor, for example, is unable to be or uncomfortable being still for extended time. As in restaurants and meetings, they may be experienced by others as being reckless or difficult to keep up with. F. Often talks excessively. G. Often blurts out an answer before a question has been completed. For example, completes people's sentences. Cannot wait for a turn in conversation. H. Often has difficulty waiting his or her turn. For example, while waiting in line. I. Often interrupts or intrudes on others. For example, butts into conversations, games, or activities. May start using other people's things without asking or receiving permission. For adolescents and adults, may intrude into or take over what others are doing. B. Several inattentive or hyperactive impulsive symptoms were present prior to age 12 years. C. Several inattentive or hyperactive impulsive symptoms are present in 2 or more settings, for example, at home, school, or work, with friends or relatives, in other activities. D. There is clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning. E. The symptoms do not occur exclusively during the course of schizophrenia or another psychotic disorder, and are not better explained by another mental disorder, for example, a mood disorder, anxiety disorder, dissociative disorder, personality disorder, substance intoxication, or withdrawal. Now, we must specify whether it is a combined presentation or predominantly inattentive presentation or predominantly hyperactive impulsive presentation. So we specify F90.2 for combined presentation. If both criterion A1, which is inattention, and criterion A2, hyperactivity impulsivity, are met for the past 6 months, and F90.0 for predominantly inattentive presentation, That is, if criterion A1, which is the inattention, is met, but criterion A2, which is the hyperactive impulsivity, is not met for the past 6 months. And F90.1 is predominantly hyperactive impulsive presentation. And that is if criterion A2, which is the hyperactivity impulsivity, is met, and criterion A1, which is the inattention, is not met for the past 6 months. We also need to specify if it is in partial remission. When full criteria are previously met, fewer than the full criteria have been met for the past 6 months, and the symptoms still result in impairment in social, academic, or occupational functioning. We must also need to specify current severity. Is it mild, moderate, or severe? For mild, few, if any, symptoms in excess of those required to make the diagnoses are present, and symptoms result in no more than minor impairments in social or occupational functioning. For moderate severity, symptoms or functional impairment between mild and severe are present. For severe severity, many symptoms in excess of those required to make the diagnoses, or several symptoms that are particularly severe are present, or the symptoms result in marked impairment in social or occupational functioning. In regards to diagnostic features, the essential feature of attention deficit hyperactivity disorder, also known as ADHD, is a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. Now, I'm going to list all the information in regards to ADHD, which is a type of neurodevelopment disorder, according to the DSM-5-TR, its diagnostic features, its prevalence, the development and course, who is at risk, and prognostic factors. Also, culture-related diagnostic issues, sex and gender-related diagnostic issues. What are the diagnostic markers? And functional consequences of ADHD. There's also differential diagnoses that is listed in the DSM-5-TR that must be considered. Now, pay close attention to the differentiation between the different types of ADHD, as well as the current severity, mild, moderate, and severe.